This talk is entitled Everything You Need to Know About Botox. My name is Alexander Ansrud. I'm a plastic surgeon in Duncan on Vancouver Island in British Columbia, Canada. I am dual board certified in plastic surgery. I'm certified by the American Board of Plastic Surgery as well as the Canadian Royal College of Physicians and Surgeons. I completed a 5-year residency in plastic surgery and then completed more than 5 years of fellowship training in subspecialty areas of plastic and cosmetic surgery. I made this video because many people come into my office wondering about Botox. They want to know what it does, where is it used, how much it costs, what are the side effects, and how Botox differs from fillers. Botox is an injection that temporarily relaxes facial muscles to reduce the appearance of fine lines and wrinkles, as well as prevent new lines from forming. In a survey of more than 12,000 patients who received Botox, 95% of them said it was worth it. I also use Botox to treat medical conditions such as blepharospasm or spasm of the eyelids, excessive sweating in the palm or armpit regions, to help improve the appearance of patients with facial palsy, to treat muscle spasms, as well as to treat migraine headaches. Botox with Dr. Ansrud may be a good fit for you if you want to reduce wrinkles and have no downtime. Treatment can be as short as 10 minutes, and there is virtually no recovery time. You're probably wondering how much Botox costs. At the time of this video production, the cost of Botox is $10 per unit, and most patients receive between 10 and 25 units of Botox. This works out to be $100 to $250. The amount of Botox required depends on the number of areas treated and the severity of your wrinkles or lines. The image to the left shows various areas of anatomy and how much Botox is generally used in each. Forehead wrinkles are usually treated with 10 to 20 units of Botox. You will start to see the results from Botox 5 days after the injection, and the final results will appear after 2 weeks. Botox will decrease muscle motion for approximately 3 months. If you decide to stop Botox treatments, recurrence of wrinkles appears over time. After 3 to 4 months, your muscles will go back to normal movement. Once this occurs, the wrinkles will start to return. This process takes time, and the recurrence of wrinkles may take 6 months. Complications are very rare and generally due to poor injection technique or incorrect dosage. If Botox is injected incorrectly, it can cause some droopiness of the eyelids or some asymmetry of facial muscle movement, and in the worst case, temporary double vision. If double vision were to occur, it would be treated by covering either eye, and the double vision would disappear. The total effect of the double vision would also disappear when the Botox wears off after 3 to 4 months. I have never seen a case of this, but it is possible. Botox can rarely lead to heavy or drooping eyelids. If this happens, it can be treated with an eye drop. Alternatively, it will resolve on its own after 3 to 4 months. Seeing an experienced board-certified plastic surgeon should reduce the chances of this occurring. There are effective alternatives to Botox as well. Botox is a form of botulinum type A that is produced by the Allergan Corporation. Alternatives include Dysport and Xeomin, and they are also made from botulinum and provide similar outcomes and results. A common question is, what is the difference between Botox and fillers? Fillers such as Juvederm or Restylane or fat grafting add volume to the face. As we age, we lose volume in the upper two-thirds of the face. Adding volume is an important aspect of facial rejuvenation. Botox is used to treat frown lines, crow's feet, provide an eyebrow lift, treat bunny lines, a pebbled chin, or a gummy smile, or excessive sweating. It does this by weakening muscles. On the other hand, fillers are used to provide volume, mainly to enhance the cheek volume, the lip volume, and smooth out the jawline. Generally, Botox and fillers are used together to provide complementary effects. This diagram shows the uses of fillers on the left and the uses of Botox on the right. Botox can be used to prevent wrinkles. If you're concerned about developing more wrinkles, but are okay with the wrinkles you already have, Dr. Ansrud can apply a small dose of Botox to prevent new wrinkles from appearing. This is called baby Botox. As I mentioned before, there is virtually no recovery time for Botox, so it can be an ideal lunchtime procedure. You may return to work or your daily routine right away. There is some uncertainty about the effects of exercise after Botox. Holding your head down or massaging the area that was injected may decrease the effectiveness. I tell patients to avoid vigorous exercise, laying down, or massaging the area until the end of that day. Botox can be used to get rid of your angry look. People with deep lines between the eyebrows, as seen here, also called the number 11s, may appear angry. This leads to people asking, "Why are you upset when you don't feel that way?" Botox is an excellent treatment for this. Botox can be used to produce a non-surgical brow lift as well. The muscles used to pull the brow down are weakened, while the muscles used to pull the brow up at the outer aspects are strengthened or activated. Botox can be used to narrow a wide jawline or square appearing jaw. The masseter muscle is injected with Botox, as in this patient. It results in a softer appearing jaw and face. Botox cannot be used to soften the under eye bags. Botox used in this area produces more bags and problems with chronic swelling. Dr. Ansrud specializes in the treatment of lower eyelids and under eye bags using either fillers, fat grafting, or surgical procedures. His research on this type of surgery is one of the most referred to publications on the topic. It's easy to get confused about the differences between Botox and fillers, so I am going to review this again. Botox is used to relax muscles and reduce wrinkles. Fillers, on the other hand, are used to enhance volume and replace the volume loss that occurs with aging. Botox and fillers are often used together to enhance the facial appearance. They both are injected, and they're both called injectables. This diagram identifies the different areas for each. The blue arrows show where Botox is used, and the pink arrows show where fillers are used. Again, Botox tends to be used to treat forehead lines, create a brow lift, get rid of frown lines and crow's feet, or treat a dimpled chin, where the most common areas for fillers include enhancing the cheeks, improving the tear trough area below the eyelid, treating the laugh lines around the lips, and enhancing thin lips. The most common areas for Botox treatment include, again, the horizontal lines within the forehead, the vertical lines between the eyebrows, the horizontal lines at the root of the nose, the smile lines around the eyes, treatment of chin dimpling, and to provide a brow lift. This diagram shows the number of units used in the various areas for Botox. Botox can be used to treat an isolated neck band. However, it cannot be used to produce a neck lift. To obtain a long-lasting neck lift, one requires a neck lift surgery such as a couture lift. This procedure was described by Drs. Timothy Martin and Dino Elias. Dr. Anzerud has studied with them and offers this procedure. If you have concerns about your neck and its appearance, please call 778-455-3223 to book a consultation. Thank you for listening to this video and learning about Botox. If you would like to come into the office for treatment or consultation, please call Dr. Anzerud. And you may also be interested in visiting our website, dranzerud.com, or following us on Instagram, Dr. Anzerud, or on Facebook or YouTube. Thank you.